This evening, I want to tell you about a new simple advance for treating a very complex heart problem.
Yeah, this used to require open heart surgery here, but today, for the first time in Tampa, surgeons are using a new technique that's really considered minimally invasive. Our own Dr. Joe is going to join us now to talk to us a little bit about this. Joe, this is interesting. Tell us.
Well, Mark, you know, in our hearts, there's a very important valve. It helps in healthy people. It helps us get the blood to the rest of our body. But when it gets really, really tight, the heart has to work extra hard to get the blood out, and that can cause your heart to fail. Like many older adults, Leslie's mom was trying to enjoy life, but a heart condition slowed Marjorie down. Her doctors didn't have a good solution.
Oh, well, she'll just get more and more short of breath, and then she'll get dizzy and pass out, and then she'll have congestive heart failure, and you know, well, that's what happens to old people.
Her heart wasn't pumping as it should. The problem was with a valve. That's when she decided to see a different cardiologist.
We felt that the main valve or the main door of her heart is not opening, and that's limiting her from exerting herself.
Every heartbeat, it was pushing against that. It was as though someone had horrible, untreated high blood pressure, and the heart eventually tires out and goes into heart failure.
In the past, the fix required surgery that was too risky for Marjorie to undergo. But Marjorie was a candidate for a new procedure here at Florida Hospital's Pepin Heart Center.
There's a valve mounted on there so that the blood won't leak back into the heart.
Edwards Life Sciences, the manufacturer of the valve, gives us a closer look in this animation. The transthoracic aortic valve replacement is inserted in the groin, and it's similar to a stent used to open clogged arteries. Patients once considered high risk are sitting up in the chair hours after the procedure.
I think for people in Tampa and people across the country, it's going to be a significant breakthrough for those patients who are inoperable.
She'll be glad to know that, you know, what she went through is going to help a lot of other people and save a lot of lives down the road.
Now, Marjorie had lung disease, COPD. That's why she couldn't undergo the surgery. Pepin, this was their first valve. Morton Plant has also inserted these valves. And Mark, get this, the oldest person to undergo this procedure was 101 years young.
That is fantastic. It sounds like a really big deal here, Joe, and I would imagine quite a few other patients are probably ready and lined up waiting, huh?
You know, yes, at Pepin Heart Center, they've got 4 in line. They're going to do 2 and 2 in the next 2 weeks. But it is a huge deal because this affects a lot of older people over the age of 65. As baby boomers age, more and more people are going to need these procedures. Again, the best procedure is to have the open heart surgery, but there's so many people out there who can't get that open heart surgery. This is going to be an option that they never had before.
No, that's fantastic. Yeah, I know you're following another advance against heart disease tonight. What's that about?
Yes, this is kind of complicated. It has to do with a receptor that's within the heart, the aorta, what we were talking about in the blood vessel walls. And if they stimulate that, they believe that it can help protect the damage that can occur over time. So that's a big, big breakthrough because we thought it existed in the liver. We found it there. They found it in the gut. It helped protect irritable bowel syndrome. And now they believe by stimulating it, we might be able to protect ourselves from those, you know, free radicals and all those things that we know damage the inside of our blood vessel walls and lead to cardiovascular disease.
Exciting heart news on this Monday. Dr. Joe, thanks very much.
Thanks, Mark.